Today on the show, the advantages of bringing all services under one roof to create a comprehensive cancer center. Welcome back to CancerBuzz. I'm your host, Summer Johnson. This is the 6th episode of our international series, where you've heard from the cancer care experts who joined the inaugural global panel during the ACCC 41st National Oncology Conference. Today we speak with Dr. Modupe Elebute-Odunsi, who joins us from the Marcelle Ruth Cancer Center and Specialist Hospital in Lagos, Nigeria.
So in Nigeria, and I think for probably the most part in sub-Saharan Africa, the major problems with the delivery of cancer care and indeed of a lot of medical care, I think sort of maybe threefold, and that's the real lack of infrastructure. There's all the indices with the SDG goals below what is expected in terms of the number of hospital beds per patient, the numbers of skilled staff that are available across the treatment pathways for cancer patients, whether it be oncologists or surgeons or even the personnel in the sort of diagnostic areas and nurses and pharmacists and so on. There is a lack of the specialized equipment that we require. And in particular for cancer patients, there are only, I think, less than 12 radiotherapy machines across the country with a population of 200 million people, where we should have at least a minimum of 100 machines. And more recently, this has been compounded by the migration of skilled staff from Nigeria and indeed most of Africa to the developed world, causing a more significant problem. And finally, there is the prohibitive costs of delivering cancer care, I think, in most parts of the world, but in particular in Africa and indeed in Nigeria, it's a problem both across the public and the private sector.
What are some of the access challenges that patients face, and what's being done to reduce those?
So for the patients, there is a lack of developed centers to look after them. There is poor access to both the therapeutic strategies that one needs to treat cancer patients and also to the staff that are needed to treat them. In addition, there is a problem with funding, which is the biggest issue because most of the patients obviously live below the poverty line. And as we just said, cancer care is very expensive no matter where you are and who you are. In Nigeria, in the last, I think, 2 or 3 years, the government has now begun to pay a real notice to this. And the current ministers of health have developed a body called the Nigerian Institute of Cancer Research and Treatment, which is focusing in trying to improve the infrastructure that's needed to grow the skilled staff that are required, and through something called the Cancer Health Fund to begin to hopefully apportion funds from the budget for cancer patients to deliver care.
Talk to us about what your comprehensive cancer center looks like.
So what I think the private sector is able to do and what we have done with Marcelle Ruth is that we can be a bit quicker to provide infrastructure and to develop skilled staff. So having spent about 30 years of my career in the United Kingdom, I've returned to Nigeria, been back full-time for about 5 years now. And Marcelle Ruth was opened, it'll be 4 years in December. We're a one-stop comprehensive cancer center, and our infrastructure and everything else we've done provides both screening, the diagnostics, and the treatment facilities. So we have our own mammogram, we've got our laboratory, we've got all the scans, we've got 2 theaters, we've got 20 inpatient beds. And in particular, we have a linear accelerator radiotherapy machine, one of 12 in the country. So our patients, when they walk in through the door, can have all the treatments they require from beginning to end of their treatment all in one place. And we've seen over 4,000 patients in under 4 years, both within the country, from neighboring West African countries and also seeing the return of medical tourism with Nigerian patients coming back to the country to be treated at home with their family around them, which is what we really need to do to improve outcomes for our patients.
Thank you, Dr. Elebute-Odunsi. Our next and final episode of this series is coming to you from Australia. Follow the CancerBuzz channel so you don't miss it. Thank you for listening. Until next time, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.